3, 2, 1. Hello, everyone. This is Danielle Ryard, aka DJ Dr. Comedian, here on 91.5 WDBK. Today we have a special guest coming from Pennsylvania, Dr. Dan Edmunds, an addictions professional, and here to talk to us about addictions and extreme states of mental health. Hi, Dan.
Oh, thank you.
Tell me a bit about, your work.
All right. Well, let me give you a little bit of background, and I'll mention a few stories here. Been in the field for about 20 years. A lot of my work has been kind of holistic approaches towards working with people who, what I term extreme states of mind, would be labeled as bipolar, schizophrenia. Later, I moved into the addiction realm. But I believe there's also a lot of overlap between the two.
Yeah. So, can you tell me a little bit about that? How they relate.
Well, sometimes it is kind of a chicken and egg sort of thing. So you'll see individuals who might not have had necessarily any mental health concerns per se, and the use of substances then triggers some things, and then once they stop using, those things kind of dissipate. There's others that I believe that the main reason why they are using is because of emotional struggles that they are having. There's basically, with addiction, there's three things that whenever I mention this, of course, everybody's experience is different, but when I mention these things, people usually say that they identify with one, if not all of them. So the first is what I would call a crisis of meaning and purpose. That somewhere along the line, the individual has felt like, what is life all about? What is the point? And when active addiction takes over, what I see as kind of the attitude is that it's not like a person wakes up in the morning and looks forward to that day. It becomes kind of just a pattern. The other part is identity. We have to kind of look at that aspect as well. That I think some people kind of lose a sense of who they are, or they may have grown up in environments where they were told what to be. And when they begin to use, they tend to sometimes find a sense of identity. However, it's not really a healthy connection. And I think that that's one of the key things to overcoming is building healthy connections. When a person is content and connected, then addiction is less likely to be part of the picture. The last thing is validation. So everybody wants to have a sense of being appreciated for who they are. And when individuals don't have that, sometimes addiction can enter the picture. Sadly, I've seen sometimes where there are persons who, in the beginning, they start to make some changes in their lives, and they go to family, friends, and they want acknowledgement for those changes that they made. And they don't really receive that. Sometimes they get kind of criticism, or, well, you haven't done enough yet, or
well, you cut down to 2 drinks a day instead of 6.
So the family members might have kind of this critical viewpoint. So it then launches the person, well, nobody cares about me, nobody cares that I'm making any changes, so I'll just go back to what I was doing before. One of the examples I give too is kind of the analogy of going on a hike. So we're trying to reach the summit of a mountain. If we do that alone, we could be halfway there or more than halfway there. And we're hot and we're sweaty and we trip over something, we sprain our ankle and we're stung by something. Even though we're halfway there or more than halfway there, our inclination may be turn back, go back to what's familiar. If we have others that we're connected with and we trust and care about us and we care about them, in spite of all of that, we might be more likely to continue that journey.
Yeah.
We might have somebody to be able, if we sprain our ankle, they'll be able to kind of carry us along to reach the top.
Right. Some professionals will say like that abstinence is not recovery. I think you've said that before. What does that, what does that mean?
Abstinence is not recovery?
Yeah. Would you relate to that terminology?
Well, I have a couple of thoughts on that. That one of the things that I have heard many times over is individuals who are receiving medication-assisted treatment. Well, they're not really in recovery. And I disagree with that because I think that that's sometimes a necessary adjunct for them to be able to continue in their journey. And actually, sometimes it's very dangerous. So if a person goes 6 months, a year, they're not using whatever, and they were to use again, the potential for overdose would be quite significant because the tolerance level would have dropped. So I don't think we need to be confrontational. I don't think that we need to draw assumptions and be judgmental in the process. I think it requires a lot of understanding and patience. And I think that's oftentimes the misguided approach that some people, they may be well-intentioned, but it has very bad outcomes when they take kind of that confrontational approach towards the person and they dictate, or they threaten the relationship. I think that actually drives the person more into their addiction. So if you don't behave the way that I want you to behave, you don't stop doing what you're doing, we're going to cut you off. But if you think about it, the common things that go into it usually have that emotional basis. It's usually when people are dealing with stressors. So there's 5 things that I looked at that I think are part of active addiction that can be overcome. One is the obvious denial that there is a problem. However, I have seen individuals where it's not really that they're denying that there's a problem. They're acknowledging that there's a problem, and they sometimes even embrace the label, but they don't see a way out.
So it's almost like they replace the label of, oh, I'm whole and I have all of these things going for me, but like that's their identity to instead of an identity of a policeman or
that becomes, so they hear this language, they're told, well, you're just an addict and you're not going to get any better and you're going to live this way, and they hear these messages. So some people start to just absorb that and say, well, I don't see a way out, so I guess that's what I am. So the other is distance. So the world starts to kind of close in on the person. The things that they once enjoyed, the people that were important to them, that starts to fade away. And sadly, whatever the addiction is to, that starts to take over. Now, that's my other argument. I think on some level, we all have addictions. We all look for distraction. We all look for ways of relief. But of course, there's kind of a spectrum to all of that. And there are some things that are more significant than others. So I remember a neighbor who every morning a package would show up from QVC, and she would put it in the closet just to order something else. Now, that wasn't something that would lead to her death, but it still was something that was maladaptive.
Yeah, she's going to fill up her closet.
Right.
Or exhaust her finances eventually.
Right. And the other little component I see is disillusionment. So some of the people that I encounter are very idealistic. Some of them are creative souls and so on, and they come to this point where they kind of have this vision in their mind of what they would like to see the world be, how they would like their lives to be. And when that doesn't pan out, they become frustrated, disillusioned, and they look for relief. The other is what I call duality. And with that, there's some people that can keep this going for quite a long time, but eventually it all kind of falls apart. And what I mean by that is kind of a double life. So I've seen individuals who could carry on about their day, do their work, so forth, and then that life shuts off, and then the world of addiction kind of opens up. And then they put that back away and they go back to what they're doing. So I don't really like the terms too much, but I guess some would say, well, that's the functional addict. The last is what I would call despair. And I think when people enter that realm, that is a real turning point. So that's where a connection has to be made, or the outcome is not going to be very good. And the things that I look at that are important towards overcoming is a sense of community, connection, and also consistency. So I think everybody has their own path to follow. And the one little example that I remember, I had a lady that her path was to do yoga, and she was on a raw food diet and all of this, and she insisted that was working for her. Now, if I took her experience and I applied that to everybody else, well, you need to eat carrots and broccoli, and you need to stand on your head and do these exercises and so forth, I would be wrong. But for her, that worked. So the key thing is, if something is working, just to be consistent with it. And so I think about it like an antibiotic. That I've had my experiences with that, where you're told you got to take it for the full 10 days. And I remember one time, like 5 days, I'm feeling better, so I throw it out. I don't need that anymore. And then a couple weeks later, you're sick again. So it's that consistency. The other little example that I will give as to how I look at addiction working is, so let's say you had chicken pox.
Right.
Did you ever have chicken pox?
I'm not sure. Keep going.
Okay, so person gets that and it's uncomfortable, and they get little bumps and they scratch at it and so on. And if you scratch too much, you might get some scars from it, but eventually it heals up and it's done. But is the virus still there in your body? And it is. It's just not manifesting anything. If you don't take care of yourself, so your immune system's down, other problems arise, that virus can be reactivated. And what does it come out as then? It comes out as shingles, which is far worse than chickenpox.
Yeah.
So I kind of look at that with addiction, that you can address it and you can get through and overcome and be empowered and so forth. But you may still have some scars from the past experiences. Right. And kind of, it's still there. It's still kind of lingering. It has to be dealt with, and you have to take care of yourself, practice proper self-care, because if one doesn't, it can launch into something that can be far worse the next go around.
Yeah, I've heard some people have said things like, when they stop doing the things that are meaningful to them, they find meaning in their old habits. And that sounds like what you're saying.
Right.
I've had friends who would do things like go to meetups, like vegan meetups or what have you, and that worked for them. They stopped using. And then when they stopped doing it, they started using again. And it sounds like that pretty much is what you're saying, right?
Right. And so as I mentioned, everybody has a different path. So some people decide to go towards 12-step programs. Some go towards other types of programs. So in my experience, I'm not pushing anyone into one specific thing. Like I said, I think they have to find their own path. But what I do see is that whatever it is, so if it is a person going through a 12-step program, I think the reason why that may work for certain individuals is because they find a sense of connection. They can share their experience with others who have been there as well.
Right.
And I think that's something that we just all need, whether that's addiction, whether that's mental health, or whether that's just being human. We all need the opportunity to be able to share our experiences with someone who understands fully because they've been there.
Yeah, there's a lot less shame to an experience when you find that there's somebody who out there who knows what that's like, or knows what it's like, or is just going to listen to you no matter what. Or yeah, there's also been one of my favorite comedians would be like, anytime you feel bad about something, Google it, Google it. I'm sure that somebody's done something just like it. And that was Maria Bamford said that.
Now, I kind of switching gears a little bit into mental health. I'll mention a couple stories of dealing with persons that were in extreme states of mind. And this was quite some time ago. I had one young man that I was aware that he had a very significant history of trauma in his life. And he began having the experience of voice hearing. And sometimes it could be distressing to him, and other times it was actually comforting to him, depending on what the voice actually was. So
I would not mind a voice that told me free chicken and pizza every day, but I would mind it if they said, I'm taking that chicken and pizza away.
Exactly. So what I notice, and this is just kind of how society looks at these things, is that when someone is behaving in an unusual way, so they're hearing voices or they're doing other behaviors that we don't necessarily care for, sometimes the initial response is to shut that experience down. So let's suppress that and make it go away, and somehow that's looked at better or progress. Sometimes I think we're making a very grave mistake when we do that. So with this young man, what I did as we built a connection and relationship was to ask him for permission to speak to the voices myself. So I treated his experience as important. And I got to know who these various entities, as he referred to them as, were. I began to discover, but I did not tell him, I wanted him to come to this discovery, that all of those voices were actually him at various points in time. So the process was to be able to reintegrate and get him back to these shattered pieces of himself, back to wholeness.
Can you give an example of how, those voices and what they might have been saying related to periods of his life?
One example was that he heard, and we explored this, as I wanted to know, are they male voices, are they female voices, the age, what they sound like. So I got an understanding of what each one was. There was a 4-year-old boy who was always very afraid they would speak to him. Well, his abuse began at 4 years old. and he was very frightened, and that's a key factor too. Those that are in extreme states of mind are very frightened individuals. And I don't think it's enough to say, well, trust me, listen to me. And actually, those are the dynamics that sometimes that they encountered through life, that when people said those things, they were often harmed when people that they thought they could trust shattered their trust.
Yeah, it's extremely problematic when somebody says, "Oh, you can trust me," and then you can't trust them. There has to be consistency between what you say and what you do for you to be a trustworthy person.
So sometimes in the beginning, it was simply just co-presence, just being there with them, and for them to get an understanding that they were in a safe environment. That had to be shown, not just me saying, "Well, you're in a safe environment." They had to actually see it.
Mm-hmm.
So he overcame a lot. Now there was another woman who, it was a similar type of experience, but also extreme. So she came to see me and she said that she was Mary Magdalene and her boyfriend was Jesus. So I think in a lot of situations, people would say, well, no, you're not Mary Magdalene. No, he's not Jesus. This is just off the wall talk. You need to stop doing that. And they would try to shut down that experience. What I looked at was, tell me what it's like being Mary Magdalene.
I'm sure it'd be a lot different than being.
Tell me about this Jesus person and what's he like. And we started out that way. Mm-hmm. And I got a lot of insight as to what her experiences were. And then I had some background information about her life and what she had encountered. And I began to realize that she connected very much with that story. Mm-hmm. But to the point where she kind of absorbed it.
She identified with that.
So gradually, over time, she began, I came to that conclusion, but I let, and it was a long process for her to realize that I'm not actually that person, nor do I need to be, but I connect with that story. And she later was able to, she got married, she got a job, she had children, she did fairly well. But it was a matter of taking that time to really delve into that experience, which sadly is something that I think in the mental health system today is something that is kind of disturbing, that there's not necessarily individuals looking to spend that amount of time. It's usually we look at these symptoms and you're behaving this way, so we give you something to address that, but it's not really getting into the root causes.
Yeah, and like 4 weeks. Well, we have, or your insurance gives you 4 weeks of our service, so we got to figure out just how thorough we got to be, and that leaves people behind, and then or the only option might be just to do a short-term medication, which doesn't work for everybody. You know what I mean?
Right. I'll mention too, and this kind of ties in addiction and mental health together, that there is a fellow that I encountered. He had a diagnosis of schizophrenia. He heard voices and so forth, but he was very frightened and never wanted to share that experience with anyone, really. I didn't know him very well in the beginning, and I guess he had an intentional overdose. So he had this huge conflict with his family. And I guess, unfortunately, this was done in a way where he snuck the substance into the facility. Mm-hmm. So they had checks and so forth, but I guess he put it in his shoes or something, and they did not find it. So the sentential overdose arose. They gave him Narcan, was able to revive him, and he became very belligerent initially with the paramedics, which is common because the person is going from having a high to a situation where they're kind of going into immediate withdrawal, kind of like hit with a terrible
He was
flu.
expecting to die.
Right. So the one thing that I was aware of is the fact that even though they have given the Narcan, that there's still the potential that they can have a second overdose. So they have to be monitored. So he didn't want to go to the hospital with the paramedics and so forth. So I brought him into the room and I told him, I said, I will go with you and I will sit with you for as long as you need me to do that, and we'll work through this. So he agreed. So I took him there. Now, one of the unusual things was here they're saying that he was basically on the brink of death. 30 minutes later at the hospital, you would not have known that anything happened. So he's eating a sandwich with me and he's telling me jokes. And it was kind of confusing. I was thinking, well, wait a minute, okay, he almost died, and now 30 minutes later, it's like nothing ever happened. But we spent 7 hours in that hospital. And a couple things that I observed there that were not very good and kind of shows how powerful stigma is and the attitudes that are still around, unfortunately, is as the medical staff came to address things with him, they didn't speak to him. They spoke to me. They directed everything to me. And I confronted that and basically said, well, he's right next to me here. He's not invisible. You can speak to him. And they eventually did. But that was not their original agenda. They were kind of like, well, they had him labeled as, okay, he's schizophrenic, he's an addict, he doesn't have anything of value. He has nothing of value to say. So the professionals have to speak on his behalf. There were others that were in the hospital.
Surely competent enough to say, you know, I'm a person, but, you know, you don't want to shut him out.
Right. Now, there are others in the hospital, too, that were there for reasons related to addiction. And I noticed that some of them were kind of stuffed in the hallway, not given rooms, and just kind of left there and ignored. So it was interesting experience to see all of that. But the connection that was made with him by doing that, by taking the time to spend with him, and he said that when he asked me, why are you doing this? I said, because I feel it's the right thing to do. And he told me that not very many people, even his own family, would not be doing that. Yeah. And they kind of looked at it. Some of them, I think, saw it as, well, this is just a pattern with him that he continues to use, and he has problems, and he's in the hospital, and he has this going, and he has that going. So they kind of had this distance from him.
You know, it was also a pattern, what he was experiencing at home.
Exactly.
So it was just in a cycle of responding to that pattern at home, but like now he has a brand new experience and he doesn't know what to do with it. But like all of a sudden, like if he's, you know, telling jokes and opening up to you, like that's because people open up and change with new experiences.
And we went from this point in the beginning where I was told that he rarely wanted any interaction with anyone, particularly professionals, to after that whole ordeal, I was having to actually kind of shoo him out of my office at times because I was busy with other things, but he was always there and wanting to talk and communicate. So it was interesting how that just by that experience and showing, not telling him, not saying, well, yeah, trust me and here I am, I'm going to fix everything for you. Just showing him an example of compassion changed his thinking and the relationship that we had therapeutically. So that definitely was an interesting experience, and powerful, because I think it certainly told me many things in many ways, and it also told me what I need to work on as far as trying to create change. And I think about that as well, that it's important in my role to also not just serve as a professional and be a therapist and so forth, but I think to be an activist, because I have to realize all of the social dynamics that are going around people that needs to change. So when we look at addiction, the opiate crisis, the #1 state for that is West Virginia. Pennsylvania is up there as well. But when we look at the lives of these individuals, we realize that this is a disadvantaged area, and these people have lived very hard lives for some time. So we have to look at, okay, what goes into this. Now, many people will often say too that, well, drugs causes poverty, causes all these social problems. The fact of the matter is, if we look at before drugs even entered the picture, did these people have social problems? Were they disadvantaged? Were they poor? Yes, they were. The drugs entered the picture as the relief that they were trying to seek. Now, did it pan out? Was that helpful to the situation? Obviously not. But that wasn't the cause of the issue. And I think that's kind of some of the mentality that we see too, is that we we want to punish people, shame them, and we think somehow that's going to bring them out of their addictions. This is going to do something for them. But it doesn't solve anything. It actually contributes to the problem. And I find it sad that we have situations where the United States will go in and we will invade other nations, and we will tell them, we are bringing you freedom, democracy, and you will enjoy it, and you need it. And you're going to have this freedom and democracy whether you like it or not.
Who's to tell me what I need?
But which country in the world has the most number of people that are not free? Not China, it's not North Korea or anything like that. The United States has the most number of incarcerated people. And so I think we have to really examine that as to why are we doing this, and is it working? And obviously it's not. The thing that I find fascinating is the Portuguese model, which is something that has worked. They had one of the highest rates of addiction in Europe at one time. And their policy was very similar to what we do here in this country, is to punish, shame. So they eventually came to the point where the problem was so massive that they knew they needed to change course. So there became eventually a reversal. So the amount of money spent for law enforcement now switched. So it's only 10%. 90% is based on rehabilitation. So there's all kinds of programs. So they wanted to create programs that where people who struggled with addiction, that they would look forward to the morning, that they would have some opportunity in their lives that they wouldn't want to use, that they would actually have a greater level of contentment. So they have had those programs. The government also sponsored a medication-assisted treatment program, and they actually went out into neighborhoods to provide it to people. And there was no real stigma. People could go, they had vans that would come around, people would be able to obtain that, and no one really made any real fuss about it. So you have a country of 10 million people who last year had less than 20 overdose deaths in the entire nation. In the small county that I live in, we had over 200 last year. So we can see by that what is working and what is not. And so it's my hope that we can begin to kind of change our course, change the policy that we have in place, and get away from this punishing and shaming concept, and to realize that we have to be there to support. Now, it's not to say that people who are struggling with addiction aren't going to make us angry at times. We're going to get upset with things that they are doing, and it does require a lot of patience.
Yeah. How do you take care of yourself, and like how do you stop taking it so personally when somebody you love and that loves you, let's say you have a husband or partner that is using, and you love them, but it's very hard to watch? What do you do to take care of yourself?
I think you have to find healthy connections yourself, and you also have to realize, just like the person struggling with addiction, of what you can change and what you cannot. Mm-hmm. And I think that's one of the struggles, is that there's this kind of idea of wanting to control everything and have everything line up in certain orders, and when it doesn't, then the person becomes very disillusioned and frustrated, and for the one struggling with addiction, that triggers their use.
Yeah, it's like, I'm upset that you're upset, that I'm upset that I can't fix your being upset, and so I'm upset that you're upset, and we're both upset, and how do I, what do we do? But, maybe you just smile and try to be there for that person, right?
Well, as I mentioned, the co-presence idea. So you do have to be there for them. And the other component that I think is important, and there's controversy to this because you're encouraging them to use or whatever, is I think the concept of harm reduction. So if a person isn't just yet ready to stop using, then there are things that we can do to help reduce the level of harm for them. And so when you think about, in some places they have created safe injection sites and that sort of thing, and that always comes with people, why are you offering these places for them to use? The fact of the matter is that use is going to happen no matter what. So would we rather them be in a place where people might be concerned about them, actually care about them, and they would be attended to so that they're not getting disease and they're not having overdoses, or if there is any type of problem, that it can be addressed? Or would we rather them be on the street alone? Yes. So sometimes I've seen that, where harm reduction can be the initial step towards a person being able to overcome. And I don't personally believe that there are any hopeless cases, because we hear that from time to time. Well, they keep doing the same thing over and over, and we can't help them. There's nothing we can do. It may take longer for certain individuals. The dynamics may not be right, but I have seen individuals where many years later, something just happened to click for them, and the dynamics change. Now I'll mention that too. So this applies to addiction. This applies to mental health. Mm-hmm. That, let's say, okay, let's use mental health as the example. So you have a person who is displaying some behaviors that are of concern to those around them. And they put them into the hospital. And while they're in the hospital, they may do very well. Why are they doing well in that setting?
That's a good question.
Sometimes because they're apart from what initially triggered the problem to begin with. So even though it may not be an ideal setting, they feel safer. And so they kind of go along with the flow and they're there. And as they comply with whatever is going on, what the hospital asks of them, then a few weeks after that, they're discharged. Well, look, they're stable now, they're doing better. But then, once they are discharged, they are returned to the same dynamics that caused the problem to begin with. Only to shortly see that it becomes a repetitive pattern. And you see it with addiction as well. A person may be sent to a rehab center for a time, and they're there for 28 days or however long, and that time maybe
their needs are being met there.
They may be able to clear their mind out and they're safe in that environment, but then they go back to a setting that hasn't really changed very much.
Yeah.
So we have to look at that as how do we change the dynamics around.
Maybe we should make the rehab at home. We should make the rehab start at home. Maybe we should make the rehab start at work. Everywhere but in the rehab facility, because that's where a person's going to be once they leave.
Well, the other thing I'll mention too is that 28 days isn't really going to cut it. And I remember in a group session that I led one time that I told people, I said, you're not going to recover here. So one fellow got kind of upset with that statement. Well, what am I here for then? I said, you may get some tools and so forth, but number one, nobody can force you into anything. Nobody can hand you anything. And here's the manual. Here's the manual for your life. Look at this, and this is what you need to do. There has to be something internal for one, and that short period of time isn't enough time to really be able to go through the process, because I don't look at it that sobriety is the issue. So some people equate the two terms together. Recovery and sobriety are like synonymous. They're not. Mm-hmm. Recovery involves a whole change in attitude, perspective about life itself, of how you find meaning, how you find purpose, how you find connection with others. So sobriety is only a part of that.
It's a symptom of a better life, rather than it's just the better life. Because, I mean, a person might just be miserable without the drugs, and maybe the misery will be an incentive to start again, and that's not good either.
Right. And that is what addiction does become for some people. It's kind of a misery loves company sort of thing. Now, I remember jokingly saying this, but then people said, that actually makes sense. I talked about how addiction was like joining a secret society, like the Freemasons or something. And so what they said made sense to them is, I said, so I was dealing with a group of people that their drug of choice was heroin, and it was IV use. Now, in the beginning, and they all acknowledge this, they didn't know how to use heroin through IV. They had to be taught that. So there had to be someone to initiate them into the process. And then there's all kinds of little rituals that go on. And there's even language and terms that people within that setting, they understand. But people that are not doing that probably wouldn't understand. So it's like the secret society. They find their connection and bond there. However, what tends to happen over time is, and people have shared this with me, is that their relationships, unfortunately, are rather superficial. The relationships tend to be kind of centered on the use. So people, when they are active in their addictions, think that they have connections, but really don't. And I've thought of it this way, of the three types of being alone. So there's the obvious, where you are by yourself and you feel lonely. And then there's what I think is actually probably worse. You have lots of people around you, but you're still alone in your thoughts.
Yeah.
And these folks that you have around you, if there's a crisis in your life, you're really having a struggle, they're not going to be there to attend to you. So, and then the last sort of being alone is solitude. So a person goes on a nature hike by themselves, and they may enjoy that experience because they're mindful, they're tuned into what's going on around them.
Mm-hmm.
And I think it takes a while for people to grow into that. I think some people, there's some that enjoy readily that solitude, and there's others that they can't, they don't know, they're not comfortable in their own skin. They don't know what to do with themselves. So I'm alone. What do I do with myself? How does this work? So that's something as well that I think there has to be growth in. The other little point I'll make too, which is kind of a theory that I've had in my mind, is that when I see persons become dependent on a substance, their emotional growth seems to be halted at that point. So unfortunately, I've seen individuals who were my age, even older, that, now it doesn't have necessarily anything to do with intellect or any of that, but just on the emotional level, they are functioning more at that level where the dependence occurred. So it's a much earlier point.
So it's basically like that's the pause button.
Yes. Now it doesn't mean that one can't grow eventually, but once the dependence on things arises, they're kind of stuck there for a time. And I learned that readily as well, that I couldn't assume anything. So there were times where, quite some time back, that I thought, well, okay, well, this person's about my age, and they should have these skills down. They should know certain things, and it was just kind of an assumption that I had. And I encountered one fellow that most of his life, unfortunately, he was in various institutions of some sort, growing up and thereafter. And once he was finally able to kind of get himself away from that, he didn't really know how to take care of himself. So he gets a job and he gets his first paycheck and so forth, and he has some funds, and he goes to the store to buy various items. So he goes to a CVS and he buys various like shampoo, soap, and all that kind of stuff there. But what else do you think he is buying there? His food. Because he walks in, well, there's food here, so I'll buy it there. Not realizing how expensive that is and having no concept of budgeting or anything. But he didn't know. But for me, and I think for many others, looking at his age, they would think, well, why doesn't he know that? Everybody else seems to know that, okay, you go to CVS for certain things, and then you go to the grocery store for the other things. But because he had never known anything other, and I think also tied into that was the halting of his emotional growth, I think all of that kind of set up that scenario.
Yeah, and people shouldn't judge, they don't know that, you can't possibly know something that you were never taught. And those skills can still come if you.
So I think that's what has to be part of rehabilitation programs too, is that we have to be able to provide education to individuals. Some people just need life skills, but at the root of that is opportunity and empowerment, that people need to feel like that they have worth. And I think that's how a number of people who have struggled with addictions, their self-concept kind of plummets, and they don't believe themselves to be capable. They don't believe themselves to be competent, or that they can overcome, and all the messages that they hear that just reinforces that, and how society treats them, and that reinforces those ideas. So I think that's what we have to really give, is this sense that yes, you can overcome, that you are a human being with abilities, with strengths. And I found that, sadly, something that I encountered many times over, is that in the beginning, a number of the people that I work with, that if you would ask them about what their strengths might be, they couldn't really identify anything. I might be able to see it. I could see certain talents they had, certain abilities, certain things about their personality that were positive, but they couldn't.
It's like you have no self-concept.
But that's all created in the systems around them. Yeah. So it can be heard from within their family. It can be heard messages from society. So
maybe nobody's ever pointed out to them, hey, you're doing this, and that makes you nice, or that makes you friendly. That makes you a good husband, a good wife, a good daughter, a good son, because other people who do this are.
Right. So they don't have that awareness, because no one has given them any encouragement in many situations. Most of the time, they're kind of knocked down, and that's just kind of the reality of it. But I think if we can work towards that concept of empowerment, and this is the same with mental health as well. The last little thing I'll mention too that I think is very important, and I'm glad to see this arising and being more prevalent, is the rise of peer support movements. Mm-hmm. So you see individuals who have been through the systems themselves and have overcome and been able to get to a point where they can then reach out to others that are currently in those systems. And I think that's a very powerful thing. And it doesn't require these folks, it's not professionals doing the work, it's people themselves who have actually been there. And sometimes that's very powerful.
Yeah, and it helps you sort of take back, this experience as a, one that needed to happen, so I can show other people this doesn't need to continue for them. There's more, there's hope, there's sobriety, there's, as you say, meaning to be found.
Right. So those are all of my thoughts on mental health and addiction, and I've kind of laid out kind of a plan for where I think we need to go.
Yeah. Why don't you tell people where they can find you on the internet, or anything you want to say about you?
I have a page, so selfgrowth.com. So if you go there, you type in my name, you'll find a lot of resources, past articles and things that I've written, available on Facebook as well.
Yeah, your articles were very inspiring, and I've read a lot of them, and some of your books were really good, especially the ones on autistic empowerment. Those were good. Maybe we'll have you on again to talk about that sometime.
Okay, thank you.
Yeah. Okay, that was Dr. Dan Edmunds. Thank you so much for tuning in. If you have a story that you would like to share, or anything related to mental health, comedy,
anything, feel free to reach out to me at Danielle@drcomedian.com. That is DRCOMEDIAN.com. We'll look forward to seeing you next week from 1 to 2. You can find me on Facebook at www.facebook.com/ Danielle Ryer Comedian. That's DANIELLERYER Comedian. All right, we'll see you next time. That's it.